what will happen then? Your center will then enroll you in a system. We go to a site and we register the patient for the particular device and manufacturer that you currently have implanted. So if you have brand X this time, at your next change out you get brand Y, you need a new transmitter. A lot of times, even if you stay with brand X to brand X, newer version, you may need a different transmitter. So if there's a change out occurred and you get a new transmitter delivered to your house, remember which is the new transmitter and which is the old transmitter, and they're really going to look alike. What I tell patients is put an X on the current transmitter you use it. Go home and do that tonight. Take a Sharpie and just put an X on it. So that you know when it comes time to change out, which is the old transmitter. So once they've enrolled you, they will explain to you the frequency of follow-up they would like you to follow. How often are they going to see you? How often are they going to look at the data? And they will explain to you when they'd like to see you in clinic. In our institution, we kind of keep it open-ended. We like to see the patients once a year. If you're in Northern Ohio, you don't want to drive in the winter. So you prefer to come in to see us maybe in the spring or the fall. It's much easier to get around. We have less snow then. Hopefully this year, I'm not sure. And then they will give you written instructions about utilizing the service. So they will have their own paperwork to give to you. This is an example of what we give our patients, and we tell them this is the remote transmitter instructions. We also say this is how to get a hold of us. If you have problems with you, call us. If you have problems setting up your transmitter, here is the 800 number that you can call to help set up your transmitter. And those are very important because what may seem simple when we explain it to you, when you get it home, it's like, now what do I do with this? It comes in pieces. Now what do I do? So again, it's very important. This is for transmitter issues. This is for problems with you. And we make that perfectly clear to the patient because sometimes you're getting so much information given to you, you don't know which number to call. So we made that clear. And then we also have how we're going to enroll them, how we're going to get started. We want, when you receive the monitor, at least in our institution, to plug it in and send us a transmission. We also tell you here our responsibilities, your responsibilities, to let us know if you have trouble with the transmitter. We'll refer you back to this phone number. To let us know that you have trouble, you didn't receive the transmitter, you have to let us know. These are all things that seem to be common sense, but you kind of have to remember them. We also give you what we call a patient's bill of rights. You have the right to have this care, and this is what we're going to ask from you and what we're going to deliver to you for this. And we have here patient's responsibilities. We ask that you know why your device was implanted. Why did they put that in there? How your device works. Is it a pacemaker and a defibrillator or simply a pacemaker? What activity restrictions to follow? And this is all up to your implant physician. How and when to follow up with your healthcare provider. How to complete your identification card and how to keep the information updated. You'll all receive an identification card that tells you your name and what kind of device you have in. If you move, we would like to know where you've moved to. We would also like to know if you've changed your phone number. Who to contact with questions or problems, and when to notify us when you experience trauma when you're in the device site, somebody hit you in the chest. You had a patient come in 2 years out, they got hit in the chest, kind of watched it, it grew and grew and grew. Of course, they were on Coumadin, they had a big hematoma there. We want to know if you're going to have therapeutic radiation. We want to know if you've had an external shock from another source. We had one patient who decided he was going to change his fluorescent light bulbs by standing in the bathtub that had water in it. Now that's not a good thing to do. Yes. So we need to know these things if you're going to do that. So when we look at the site, we see something different than you do. And I've got up here all 4 vendors. This is Biotronics Home Monitoring Site. This is Medtronic CareLink, Boston Scientific Latitude, and the Merlin TrueStar, which I love the stars on it. Patients say, Merlin, isn't that King Arthur? Yes. So we go through all that. But these are the sites that we log into to look at your information. And you can see on this site, I had already logged in, and I had some transmissions coming in. I know how many patients need to do something. And I have little updates for me. Same thing for latitude. I can log in here. Same thing for Merlin. I can also do a bunch of things from here. So the next step. You've been enrolled. You have your device. You know what phone service you're on. You know what your follow-up's going to be. Now, within a week or two, you're going to receive a transmitter through the mail system. FedEx, UPS, the guys with the brown shorts of the FedEx truck are going to come to your house, and they're going to deliver a transmitter. It's going to come in a nice box. You know, it's going to be colorful. What we want you to do is make sure you bring it into the house and plug it in. That's very important. So what does the transmitter look like? So if I look at these, a lot of these are going to be in your bedside. This is Biotronics 2 versions. This is landline only. This is a cellular. This is Medtronic's CareLink. Here's one with a wand. You may have to use a device that has a wand on it. Simply like the wand when we interrogate your device in the clinic. It looks just like that. Here's Merlin. Oops. Here's Merlin. And they all have lights. They all whistles and bells on in. This one, the towers light up. And here is Latitude. Here's another one with a wand, in case you have an older device that may need a wand to transmit. See this antenna? This is a wireless system. It's going to come into us. Same thing with here. So again, you have to have the right transmitter to go with your device. Your responsibility. Now we come into play here. You need to open the box. I know that's hard, but you need to bring it off the porch. You need to open up the box. One of my friend's husband has a CRT ICD. And I said, Carol, I'm going to send him a transmitter. I want you to see how long it takes him to bring it in and to set it up. She goes, why? And I said, just curiosity. So it came to the house. He called her at work and said, the box came. She goes, okay. So the box came in that day. It sat on the dining room table for 3 weeks. And this is a person who works in the industry. And I kept calling. I said, look, open it. No. Did you help? No. I said, this is his. He needs to open it. So it took 4 weeks for them to bring it in and send us a transmission. So what we want you to do is open the box and read the information provided in the box. It's loads of information in there. There's a DVD. There's an instructional sheet on just how to hook it up. It's very simple. Diagrams. View the DVD that's included. Set up your system, and in our case, we want you to send us a test message. We want to see it come in. We want to see it work. If you have a problem, if the problem is related to your health or you feel something is wrong, call your follow-up center. That seems pretty simple, but when all this information comes at you, you're going to get confused as what the transmitter can do and what the center can do. Problems with you, call the follow-up center. If the problem is with setting up the transmitter, call the manufacturer. There's an 800 number on your identification card, and one is also included with your transmitter. Those are numbers that you stick on the fridge magnet. So you know where they are, so in case you have a problem, all of a sudden it came unplugged, you lost the DVD, you don't have the cord, you have some questions. You can give them a call. They'll help you out. They're very nice people. Trust me, they will spend hours with you trying to troubleshoot in case there is a problem. So what data do we get? What data do we get to help you with this early warning system? What's the first thing when you go into your clinic? What do you want to know? How's the battery? Time to change up. Usually that's the first question. You all know if you've had shocks. You all know, somebody want to know how much atrial fib if I have, because that's very common. But most of the times, how's the battery doing? Are the leads okay? How are you and the device getting along? It's a marriage. And some patients really don't get along very well with their device, and we have to fine-tune their device a little bit to make it better for them. So we look at something called diagnostics. And these are very important to us. To you, they look like, you know, when you go to clinic, that reams and reams of paper that comes out. But we can look at that. Again, I heard some people talk, he says, well, you know, they interrogated my device, and they told me I didn't have any AFib, and I hadn't had any AFib for a while. And I was really pleased about that. Well, your device can tell us that. It can tell us that over the phone. So this same set of diagnostics that we see in the office is the same thing we get over the phone system. Any episodes we may have had of any arrhythmias. Are they atrial fibrillation? Are they ventricular tachycardia? Are they ventricular tachycardia that you're not aware of? Are they atrial fib that you're not aware of? Atrial fib is very common, and we didn't know how much atrial fib there was until we had devices that would tell us. Because some patients are totally asymptomatic. They don't feel it at all. Others can tell you when they're in it for 1 week.